Kevin Hern calls it reform. Jim Priest says Oklahoma families and taxpayers will pay the price. This article looks at Medicaid, SNAP, rural hospitals, paperwork, and the cost Oklahoma may be asked to absorb. There is one part of the argument that most Oklahomans probably agree with. People who are able to work should work. That is not really the argument. The harder question is whether the law Kevin Hern voted for actually puts significant numbers of people to work, or whether it creates another government paperwork system that catches eligible Oklahomans along with the relatively small number of people the policy is supposedly designed to reach. We do not have to speculate. Arkansas already tried Medicaid work requirements. Georgia built its own version. The warning signs are already there. Now Oklahoma families, hospitals, and taxpayers are being asked to test the theory again, after real-world trials in Arkansas and Georgia produced little or no employment gain, substantial coverage losses, and major administrative costs. Start with who is actually on Medicaid. Sooner Care is not mainly a program for people refusing to work. It covers children, older adults, disabled Oklahomans, low-income workers, and families. Our earlier research found that children and aged, blind, or disabled adults account for about 67% of Oklahoma Medicaid enrollment. Those groups are not a workforce problem. Children cannot be sent to work. A seriously disabled adult cannot be turned into a new employee by adding another government form. The remaining Medicaid population is where the work rule argument is aimed. But even there, the stereotype starts falling apart. National data we reviewed showed that about 92% of the relevant non-disabled Medicaid adults were working, caring for family members, attending school, or dealing with illness or disability. Only about 8% were unemployed for other reasons. So the question changes. How do we avoid throwing eligible people off health insurance while trying to find the small number who are actually refusing to work? Paperwork is not free. For an hourly worker, 2 hours away from work can mean 2 hours without pay. Missed mail, unreliable internet, changing work schedules, no paid time off, and caregiving responsibilities do not prove someone is unwilling to work. They prove many low-income workers do not have office staff available to handle government paperwork. Arkansas already ran the experiment. Nearly 18,000 adults lost Medicaid coverage. Researchers found no significant increase in employment. Among people who lost Medicaid in Arkansas, half reported serious problems paying medical debt, 56% delayed medical care because of cost, and 64% delayed taking medicine because they could not afford it. The Government Accountability Office reported that Arkansas expected about $26.1 million in administrative costs for its work requirement demonstration. Georgia spent $80.3 million on its demonstration through March 2025. About $54.2 million went to administration. About $26.1 million went to medical assistance. Georgia spent more than twice as much administering the eligibility system as it spent providing medical assistance to people who successfully enrolled. Oklahoma may spend about $30 million handling additional Medicaid eligibility checks. That money buys administration. It does not buy one additional doctor visit. SNAP adds another cost shift. Starting October 1, 2026, Oklahoma's share of SNAP administrative costs rises from 50% to 75%. Oklahoma Human Services requested about $25.5 million in additional state funding. That money operates the program. It does not buy one additional bag of groceries. If Oklahoma remains in its current error rate bracket, the state could owe roughly $220 million a year in SNAP benefit costs that Washington previously paid. An error rate is not a fraud rate. It can include overpayments, underpayments, processing mistakes, system errors, and household changes handled late. Our earlier research found that about 79% of SNAP participants are children, elderly people, or people with disabilities. A child does not have to violate a work rule to have less food in the refrigerator. The household simply has to lose assistance. Oklahoma's household food insecurity rate was 16.9% in the 2022 to 2024 average. Cuts do not erase hunger. They move it to food banks, churches, schools, clinics, hospitals, and family budgets. Now follow the rural hospital money. Oklahoma received about $223.5 million for the first rural health transformation budget period. That is real money. But the hospital risk is much larger. Oklahoma healthcare leaders estimate hospitals could lose about $6.3 billion in Medicaid reimbursement over 10 years. A grant does not erase the cuts. Oklahoma's first grant period is about $223.5 million. The average yearly hospital loss estimate is about $630 million. A 5-year transformation fund is not a permanent reimbursement stream. Hospitals do not disappear all at once. First services disappear, then patients drive farther. Then the community loses jobs, confidence, and part of its future. The hospital serves everyone: the Medicaid patient, the Medicare retiree, the privately insured farmer, the teacher, the small business owner. It is one emergency room. This is the Hern-Priest contrast. Hern emphasizes work, accountability, tighter eligibility, and lower federal spending. Priest emphasizes what happens to families, hospitals, and communities when benefits disappear. Hern has the legislative record. He voted for the law, so he should have to defend the results, not just the phrase work requirement. Questions for Kevin Hern. Why should Oklahoma expect a different result than Arkansas? How does a short-term grant replace billions in hospital losses? How much paperwork loss is acceptable? Priest must answer too. Would he repeal the work requirements? How would he reduce fraud and errors without building another expensive bureaucracy? How would he pay for his changes? The real governing question is this: how do we distinguish someone refusing to work from someone already working irregular hours, caring for family, or stuck in a paperwork failure? Washington records the savings. Oklahoma still has the sick person, the hungry child, the struggling hospital, the food bank, and the administrative bill. That is the Oklahoma bill. Kevin Hern calls that reform. Jim Priest says Oklahoma families will pay the price. Taxpayers should ask the same question. Next in this series, Social Security. Kevin Hern has discussed raising the retirement age. Next, we look at what that means in a state with shorter lives and poorer health, and what Jim Priest proposes instead. Sources used include the Oklahoma Health Care Authority, Congressional Budget Office, Government Accountability Office, Oklahoma Human Services, Oklahoma Hospital Association, USDA SNAP data, and prior Follow the Money research. Follow the Money. Read more at langdon.substack.com.